Dr. Richard Eby, and today we're going to talk about minimally invasive foot surgery. This has also been called minimal incision foot surgery, but more commonly now it's referred to as minimally invasive. Minimally invasive foot surgery means doing traditional surgery, removing bones, moving bones around, as we'll see here in a minute, through a small incision. In the past, this has been around a long time, and in the past, some people have sort of condemned this as being blind surgery, being that you couldn't see it. A little incision was made, you put a burr, a rasp, or a blade, and who knows what you were cutting. Well, that's really not a valid concern anymore, because we have technology now with a C-arm fluoroscopy that we can see the bones while we're working on them without making a big incision. As I have here, these are just saw bones, which are artificial bones used to practice surgery. You can see here a staple was put in this one, and again a little bit bigger incision would be needed to put a staple in the bone, but it's possible to put a screw in through minimally invasive foot surgery, and a number of things you can do with it. In a case like this, and this is just an example of a bunion with a deviated big toe or hallux, cut was made in the bone, can be done with a burr, as we'll see here in a minute, to remove a wedge of bone, and then the toe would be taped or bandaged in the corrected position. If you wanted to, you could put a screw or a pin in this. Again, it could be done through a minimal incision. Not all foot surgery can be done under minimal incision. Some bunions are too severe, arthritic involvement, they can't always be done that way, but in many cases it is possible to do it. This is the kind of equipment we're using now. Of course, right now this isn't sterile, but if we were doing surgery, everything here would be sterile. And this is just to show you that through a burr, again, a very small incision would be made, and the bone can be cut with this. So the burr could be placed, for example, at the spot where you wanted it. The C-arm or mini C-arm could be used to then cut the bone, make the cut in the bone, and whenever it's completed, I'm not going all the way through it, the area could be closed and fixated. So we're going to take a look now at some of these things under the fluoroscope or the mini C-arm, and again, just with the saw bones that we